Hey everybody, Dr. Michael here with Valiant Physical Therapy, where I specialize in working with runners here in Evanston, Illinois. And I want to talk about 3 warning signs that the pain that you're experiencing and that you're trying to run through is actually an injury, and it's telling you that you're probably going to need to take a break from running. Okay, so the first thing, these all kind of seem obvious when you say them out loud, but when you're in the running injury, it's easy to kind of overlook these things. So the first thing is if the pain that you're experiencing is forcing you to alter your mechanics. Okay, so if you're running, and you're kind of limping along, or you're not really striding the way you normally do because something hurts, or you're trying to avoid doing something, and you're kind of galloping along or something like that, or you're having to change your mechanics in some way to avoid the pain, then, or if you even are experiencing pain, even with the altered mechanics, that's a big sign that what you're dealing with is not something that you should be running through. Okay, so altered mechanics is the first one. Pain that gets worse with running is the second one. And this is the tricky one, because a lot of times people feel sensations as they're running, and maybe they're even a little bit sore after they run. So it's kind of like, all right, well, is this a problem? Is this not a problem? If you're having a pain at the start of a run, and as you're running, you're noticing that it's getting worse, and then it's worse after you run, that's an injury. You're running through something that's telling you, hey, running is not good for this, okay? Sometimes, in the example of like a hip, okay? Sometimes whenever I'm treating someone that actually has some degree of like a hip tendonitis, or even some people with hamstring strains, I'll actually have them do some jogging or some light level running, because the motion is good for things like that from a tendon standpoint. So they'll start with some degree of discomfort, but then as they start to run, it actually feels better. They open up and they feel good after the run. So that's something where, you know, you're feeling some degree of pain and discomfort, but you can actually run through that. But on the reverse side, if I'm working with someone that has a bone stress injury, or, you know, we're not sure, if they tell me, hey, the pain's there when I run and it gets worse as I'm running and then it's sore afterwards, the body's telling you that running is not good for this, whatever the injury may be. So altered mechanics and pain that gets worse with running. And then the third one is pain while walking. If, let's say, you've been off running for some time and you're trying to rest the injury, and you're debating, okay, can I start running? Like, when am I ready to start running? If you're having pain with walking, then you're probably not ready to run. So running is basically a series of single leg jumps, all kind of happening in an orchestra in succession. And if you're having trouble with just flat ground walking, you're probably not ready to start doing a bunch of repeated bounds, right? So the pain while walking sometimes can also be a little bit tricky, because sometimes the tendinous things like an Achilles tendonitis can kind of warm up if you're doing the walking correctly, if you're in the right footwear. But if you're having pain with just walking around, you're probably not ready to run. So signs that you're running through an injury, or that you actually have an injury that's going to warrant some degree of rest from running, are altered mechanics when you try to run, pain that definitely gets worse because of running, and then any amount of pain that you're having while walking are 3 signs that you probably shouldn't be running right now. I hope this was helpful. Maybe hard to hear, but thanks for watching. And if you like this video, give it a thumbs up. Thanks.